which buprenorphine product to use and how much. I'm sure this video will get a lot of hits because there's a lot of interest in this. The first buprenorphine product put on the market, I think it's late 80s, was Buprenex. It was an injectable form. You could do either intramuscular IV, and it was mostly paramedics. It was used for mild to moderate pain. When someone's in pain, they would inject this in the field. I mostly saw it with paramedics. I do know some veterinarians use it for cats and dogs. That was buprenorphine. Then Subutex came. Subutex was just pure buprenorphine. It first came in a tablet, then it came in a film. That's the brand name. There's no reason to use the brand name. As I will continue to discuss, just use the generic. It's a difference between like $300 or like $50 to $60. So buprenorphine generic is the way to go. It comes in 8 milligram, 2 milligram tablets, or it comes in 8 milligram or 2 milligram films. The tablets, if you're on maintenance, know your dose, just keep using the tablets. Generic. It's the cheapest, most effective thing out there. They make Suboxone. All that is buprenorphine with naloxone. What is the point of using naloxone? It prevents people from injecting it. In every 8 milligram tablet of buprenorphine in Suboxone, they put 2 milligrams of naloxone. In every 2 milligram tablet, they put 0.5 milligrams of naloxone. The only difference between Subutex and Suboxone is the naloxone, and it's only active if you inject it. I think the product, no, I don't think. The product was manufactured to prevent IV intravenous use of buprenorphine. If you use this drug intravenously, you can get high. So use generic. If you need, for whatever reason, there's fear by your practitioner that you may use IV drugs, use generic buprenorphine and naloxone. And once again, this product, which is also called Suboxone, buprenorphine and naloxone, all it is a mixture of buprenorphine and naloxone, and the naloxone is not active when it's used sublingually. It's only active when injected. The generic products of buprenorphine or buprenorphine and naloxone is the way to go. Now, if your insurance company says, well, we only cover Subsolve, which is a mixture of buprenorphine and naloxone, use that. It doesn't really matter. Use the cheapest one. What's important here is the means of entry into your body, whether it be a tablet or a film or a patch. There is a patch available. It's called Butans Patch, which is a transdermal buprenorphine patch. It's fine. It's really expensive. So if, for whatever reason, people can't use the film or the tablet because sometimes it rots their teeth or causes sores on their mouth, they have to use the patch, which is much more expensive. There's another strip, buca strip, which is fine. But listen, get the generic strip. The tablets are great because they come in 8 milligram or 2 milligram, but the strip can be cut into any size you want. So it's much easier if you're having trouble tapering, use the strip and you can cut a 2 milligram strip in half, in quarters, in 1/8. So you can get like 0.5 milligram increments if you're cutting the strip. And some people find that the easiest way to come off is using the strip. You can't keep cutting a tablet into little bits. Where the strip, you just cut it in as small pieces you want. I've had patients use an 8 milligram strip and spend 2 weeks, 3 weeks just cutting a little bit off the strip. There's Bonneville, which is a strip that's a mixture of buprenorphine and a naloxone strip. It's fine. If you can get it cheap, get it. Then there's a new product. On top of having an XDA number, to use the next one, Sublocate. It's an injectable that lasts a month. That practitioner needs a special certification for Sublocate. It's really expensive, like $1,600 a month. I mean, certain patients, I have one who's on Sublocate. It's great, but it's really expensive, and you really have to be have issues that are unique, that you need to have an injectable once a month. Issues of compliance, issues of fear of relapse, fine. Now, so we discussed which type of buprenorphine you should use. I'm saying use the generic, the 8 milligram, the 2 milligram tablets. If you need to taper it, the film might be better. If you're an IV drug abuser, use a product that mixes buprenorphine with naloxone so you cannot be tempted or cannot use an IV injectable. Now, to individuals who cannot tolerate the tablet or the film, I recommend using the patch, the Butans Patch. Now, people who have issues with compliance or fear of relapse, or they won't take the medicine, there's a host of issues that are unique to this patient. Use the IV, the injectable that stays in your body for a month and slowly releases, called Sublocate. So we've discussed tablets, films with both buprenorphine and products with buprenorphine and naloxone, and we've discussed patches, and we've discussed the once a month injectable that slowly releases. Now, what's the dose? Heroin, people, it comes down to 500 milligrams to 1,000 milligrams a day. They use caps or they use bags. I'm from New York City. They use bags in New York City. They use caps in South Florida, in the South. Roughly, I figured it out that each cap is about 100 milligrams of heroin. Each bag is between 100 and 200 milligrams of heroin. So most people are using between 6 to 12 caps or bags a day. Everything is up in the air because now people are cutting with fentanyl. So buying heroin on the street right now is like Russian roulette. You get too much fentanyl, which is measured in micrograms, 1/1000th of a gram. It's really difficult to keep it safe because the slightest miscalculation in your dose, you overdose and die. So if you're buying heroin on the street and you get a little bit too much fentanyl, you can't even see the amount, you're dead. Don't buy heroin on the street. It's very, very dangerous because if it's cut with fentanyl, you'll most likely overdose, get respiratory depression, and die. Do not do that. The average dose in this office is 300 milligrams a day of oxycodone or hydrocodone. I get some dilaudid people, which are oxymorphone, which is a different, not that many. Most people are using hydrocodone, oxycodone, 300 milligrams a day. The conversion rate to buprenorphine is 8 milligrams twice a day of buprenorphine. I've had people go up as high as 1,200 milligrams a day of oxycodone. So at 600 milligrams a day, I give 16 milligrams twice a day of buprenorphine. And at 1,200 milligrams of oxycodone a day, I give 32 milligrams twice a day of buprenorphine. Higher doses of buprenorphine can be used in people with chronic pain. So I've given 16 milligrams 3 times a day in people with chronic pain where they were on very high doses of oxycodone to treat the pain. Someone taking over 100 milligrams of methadone a day, the ratio, that's about 600 milligrams a day of oxycodone. So that individual would get roughly 16 milligrams twice a day of buprenorphine. Now, under 100 milligrams of oxycodone a day, you probably can get away with 4 milligrams twice a day of buprenorphine. I've gotten people 30 milligrams a day of of oxycodone or hydrocodone. I give 4 milligrams or sometimes 2 milligrams 3 times a day of buprenorphine. And sometimes I get people come in with, I just had a woman come in with, 5 milligrams a day, and she's very addicted. Oxycodone, I gave her 2 milligrams twice a day of buprenorphine, and she was fine. That's roughly the conversion ratios. Less is more. Trust me, if you're on this, you may pulse up because you feel you need it, because you're so afraid you're in withdrawal. Pulse up for 1 or 2 days of the buprenorphine, maybe go to 16 milligrams twice a day. Get right back down to 8 milligrams twice a day or 2 milligrams twice a day, because buprenorphine itself is difficult to come off of. So I have a lot of patients coming off of buprenorphine, you can go from, say, 64 milligrams a day of buprenorphine a day to 4 milligrams twice a day. You don't have much problems in terms of withdrawal. It's that 4 milligrams is like that line in the sand. 80% of the receptors are occupied at 4 milligrams once a day of buprenorphine. So you can go from 64 milligrams a day to 4 milligrams a day, and 80% of the receptors are still occupied. So you're not in that much withdrawal. Once you drop below 4 milligrams a day, let's say you drop to 3, you go from 80% occupancy of the receptor to like 50. 4 milligrams a day of buprenorphine is like easy to get to. But once you get to 4 milligrams a day, that's where the real detox begins. And that's where you start using the film. Cut your buprenorphine from that point from 4 milligrams to 3.5 to 3 over maybe 5 to 10 days, decreasing it. So you can go from 64 milligrams a day to 4 milligrams twice a day. Once you start decreasing from 4 milligrams twice a day, the occupancy rate of the receptors goes from 80% at 4 to 3 is 50, to 2 is like 30, and to 1 is barely anything. I don't even think people can feel it. It's so low. So get yourself to 4. The major side effects of coming off would be malaise, feeling terrible, and fatigue. That's what I see. I mean, how much is psychological, how much is physical? People just tell me I feel terrible, you know, but they can work and do stuff, and there's things I can do to help them with withdrawal, but you'll get through it. So the fatigue is a major issue. I've used Provigil or Nuvigil, modafinil or armodafinil to help people with the fatigue. It gives them energy and it's not addicting. And then I use medicines to help them sleep. I have used mirtazapine, which is Remeron, or Ambien, just to help them sleep. They feel a lot better. Once you stop, you got 6 weeks where you're not feeling too great. So I've kind of given you the parameters of where to go with buprenorphine, the dose, some of the pitfalls you'll run into, and the different modes of entry, and what's the reasons you need to use them. Also, that's the end of this video. Here's my book, Tales from the Couch. I'd appreciate if people would go on Amazon.com and buy it. Also, check out my blog. All the work that goes into everything I do is on that blog. And just for the few people who send me emails, why did you chop off your curls? Let the curls grow back. I'm not chopping off any more curls. Whatever. Thank you, Dr. Mark Agresti.